listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers.
Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at question 25. You hear a physician explaining the micro-laparoscopic pain mapping procedure to the nurse. Now, read the question.
Micro-laparoscopic pain mapping. At times, finding the cause for pelvic pain becomes very difficult. This is especially true in the case of pelvic scar tissue, endometriosis, fibroids, and other problems. In a pain mapping procedure, the patient is given some strong medication to make them sleep. After injecting local anesthetic medicine into the navel, the physician will insert a small bubble of gas inside the belly and insert a laparoscope of very tiny diameter inside the belly to look around. Another small instrument is inserted lower down on the belly and used to touch organs inside after the patient awakens. While touching the internal organs, the patient will denote whether the patient is getting pain when touching specific organs. For instance, if the endometriosis is causing pain, it will be tender while touching the organ with the instrument. Moreover, when the patient experiences pain on the right side, it is difficult to make out whether the pain is in the ovary or the appendix. Therefore, pain mapping could help figure this out and help the physician pick the exact procedure.
Question 26. You hear a physician discussing the role of vitamin D in lung disease. Now read the question. Doctor, could one kind of lung disease have its roots in vitamin D levels?
Interstitial lung disease is an unusual, but at times deadly form of continuous scarring of lung tissue. A new research by a cardiologist has proved that the condition may be due to low vitamin D levels. Calcifediol is the biologically active form of vitamin D that is hydroxylated by our kidneys to form calcitrol, that circulates as a hormone in the blood, playing a major role in regulating the concentration of phosphate and calcium. Its anti-inflammatory effects modulate our immune system and also have antifibrotic effects, regulate various genes involved in fibrosis or scarring. Therefore, if you have the low level of vitamin D, that may be a contributing factor for the lung disease. However, many cases of interstitial lung disease aren't related to any particular factor. Therefore, vitamin D levels may be an unusual risk factor that would be easy to evaluate. New research will focus on correcting the vitamin D levels and in finding out if the condition of the patient resolves or stabilizes.
Question 27. You hear a doctor explaining the causes of pyloric stenosis in children. Now, read the question. Pyloric stenosis. When the muscles in pylorus thicken, that narrows the opening of the pylorus and prevents the food from reaching the intestine. This kind of narrowing of the lower portion of the stomach is known as pyloric stenosis. Typically, this problem occurs in newborn children between 2 to 8 weeks of age. As the pylorus thickens, the stomach opening is blocked. Therefore, the food cannot move into the intestine. This causes a patient with pyloric stenosis to vomit, which could result in several problems. Dehydration is the major problem caused by pyloric stenosis, since the regular vomiting devoids the fluids for the nutritional need of the infant. Secondarily, minerals such as potassium and sodium are lost through vomiting, making the baby weak. Mainly, the firstborn male babies are vulnerable to pyloric stenosis. Smoking or intake of tobacco during pregnancy doubles the chance of pyloric stenosis in infants. Bottle feeding is also another cause for developing pyloric stenosis. According to findings, infants giving antibiotics in the first 15 days of their birth have the greatest risk. Question 28. You hear a doctor explaining issues caused by increased testosterone in postmenopausal women. Now, read the question. Hello, doctor. Is it essential to measure the testosterone for postmenopausal women?
Well, according to research conducted by a cardiologist, higher levels of testosterone in postmenopausal women is the main cause for their cardiovascular disease. Testosterone is a type of hormone known as the androgen in the male. Therefore, a higher level of this hormone in women causes high blood pressure, adverse lipid profile, and other unforeseen health issues. Usually, testosterone becomes more dominant in women after the menopause. However, screening for hormone levels during such health conditions is not in practice at present. Symptoms of an excessive level of testosterone in a female include excess facial and body hair, deepening of the voice, acne, increased muscle mass.
Question 29. You hear a doctor discussing the methods to control narcotics use by the patient. Now, read the question.
Hello, doctor. Is there a comprehensive approach to keeping pain under control, avoiding narcotics?
Yes, according to a pain expert who has established a multidisciplinary pain clinic engaging physicians, acupuncturists, massage therapists, psychiatrists, and patients to kick the opioid habit. One fundamental practice followed is signing an actual contract with a patient mentioning that they will not use any kind of narcotic while they are getting prescriptions from us. Moreover, they will also not do anything outside of getting another prescription from any other provider. We will tell them that we will be randomly doing urine examination, and we tell them if they keep getting positive urine tox screens, we are not going to provide them medical services, so then they have to go and find another provider. Occasionally, we get a positive tox screen, and we confront the patients, and we warn them. If it happens next time, they cannot come to our clinic anymore. Question 30. You hear a doctor arguing about nose inflammation, whether it is good or bad. Now, read the question. Hello, doctor. What can the nose inflammation teach us about how the human body repairs itself?
We have the ability to smell things because of our olfactory system. However, according to research by an otolaryngologist, For the patients with chronic sinusitis, inflammation on overdrive compromises this system. The greatest problem in patients is just the ability to smell due to inflammation, as in the case of chronic sinusitis, for instance. It's evident that chronic inflammation is bad for the olfactory system, at least in the early stages, to begin the repairing process. It is surprising that inflammation actually plays a beneficial role in early repair of tissues that allow us to smell. Therefore, inflammation is a normal and essential process in repairing. But the question is how to regulate inflammation to preserve the good and mitigate the bad.
That is the end of Part B.